Welcome to Have More Babies. Today, we're cutting through some of that confusion around healthcare decisions. We're diving into what's basically the ultimate family roadmap. It's a crucial document about navigating health insurance, and specifically geared toward getting the best specialized pediatric care right here in the Georgia area.
Okay, yeah. Let's unpack this. I mean, we're dealing with something that often feels, well, overwhelmingly subjective, doesn't it? But this guide we looked at, it offers some real objective clarity. It really tries to simplify the whole selection process by rigorously evaluating 7 of the big health insurance companies in this market. And the goal isn't just, basic coverage. It's about finding a provider that offers genuine financial protection and, crucially for families, seamless access to those pediatric services that, frankly, go way beyond just a simple well-child visit.
Absolutely. And, when you look at the industry dynamics, the sources we reviewed really highlight this continuous, almost aggressive competition. Every provider claims they've got the most comprehensive package.
Right.
And this product differentiation is always emerging, sometimes in these surprising niche areas. So the central question really becomes, how does a new family or a growing family make a rational strategic choice?
That's exactly where the criteria come in. See, we aren't just looking at marketing fluff here. The evaluation criteria used in this material, they're based on a pretty comprehensive, well-rounded assessment. Things like network size, customer service, cost structures, and importantly, those specialized benefits.
Okay.
This selection process is just key because the difference between one carrier and another, I mean, it can mean hundreds, maybe even thousands of dollars saved. And also the difference between quick access to a specialist or, a long waiting game.
That distinction is everything, isn't it? So let's look at the carriers that were highlighted for their unique specializations, the ones where that competitive edge is really sharpest. This is where I think it gets really interesting, because some providers, they've clearly invested heavily in these niche benefits, and that might make them the strategic choice for certain families, even if they aren't, say, the cheapest overall.
Yeah, exactly. We can start with companies that really excel in specific, often high-cost areas. Okay, so first up, let's talk about Humana. Now, while they're massive across the board, the sources consistently flag them as, best for Medicare coverage.
So what's the implication there for families with kids?
Well, think about multi-generational households maybe, or families supporting older relatives. Humana's strength here lies in its really comprehensive coverage that often bundles in added options, things like integrated dental and vision coverage, fitness programs, and these pretty expansive wellness services.
Yeah.
So if you need a provider that can handle, say, both your young children and your aging parents under one coordinated umbrella, Humana's established strengths in that integrated senior care, that's a significant advantage.
That's a great angle, looking at the carrier's broader market strength to kind of predict their stability and fit for the whole family. Okay, next, you mentioned Cigna being a standout in the pharmacy world.
Yes, Cigna definitely earns its distinction as best for pharmacy programs, and this is really critical intelligence for parents. The real insight here, I think, is that for families dealing with maybe chronic pediatric conditions like ongoing asthma treatment or ADHD medication.
Right, things that are consistent costs.
Exactly. Or just high recurring medication costs in general. Prioritizing Cigna's robust pharmacy program, it might actually offset a higher premium overall.
Oh, okay.
See, Cigna negotiates really competitive pricing with pharmaceutical companies, and they pass those savings directly to members.
So it's like a smart money play investing in the carrier that aggressively manages what might be your most expensive recurring line item.
Precisely. And a crucial detail the analysis pointed out: preventive medications, like childhood vaccines, even contraceptives for teens, they're often made available at a lower cost or sometimes even free to members.
Wow. That's tangible, immediate savings families can actually count on.
Yeah.
Okay, and rounding out this specialization group, you have Ambetter. They focus on dental benefits. Another, let's face it, high-cost, high-frequency need for growing kids.
Right. Ambetter is specifically noteworthy for their comprehensive dental benefits package. And we're talking coverage that ranges from those routine, twice-a-year checkups and cleanings, all the way up to fillings and even major dental procedures that kids, they often need as they grow. They really stand out because they stress affordability and competitive pricing while still maintaining an extensive network of dentists.
That network piece is key for dental.
It is. And they make sure that network is regularly updated, which means hopefully less frustration trying to find an in-network provider near you.
That's a fantastic breakdown of where carriers really differentiate themselves. Very helpful. Now, let's maybe shift our focus to the giants. The company is known more for superior service, massive scale, and just overall user experience. The carriers that families often rely on for smooth operations day to day. Let's start with Aetna.
Hmm.
The sources claim they have the best customer service. Wait, best customer service? I mean, that's a huge claim in the insurance world.
Yeah.
What specific data in the sources backs that up? Because, I don't know, in my experience, calling an insurer usually involves a lot of hold music.
That's a perfectly fair skepticism. It really is. The analysis anchors Aetna's distinction in two kind of verifiable areas. First, they seem to prioritize transparency of data, providing clear, concise information about costs and coverage so you can make rational choices before you even get to the claim process.
Okay, that's helpful.
Second, they are highlighted for exceptional after-sales support. And this isn't just about phone hold times, like you said. It's about their efficiency in resolving disputes. Coordinating complex care across multiple providers, which happens a lot with kids' health, and processing claims promptly. The goal seems to be removing that administrative burden from you, the patient.
Which, for a busy parent, yeah, that's priceless.
Exactly. Moving on, you've got Blue Cross Blue Shield, or BCBS. They stand out for overall customer satisfaction. They're kind of the definition of a trusted national name, right? Consistently earning high scores in broad customer surveys across different regions.
Yeah, that national trust is huge, isn't it? Especially maybe for military families or folks who might move frequently.
Exactly. Their trustworthiness seems built on reliability like prompt and efficient claim processing year after year. They also utilize technology pretty well, providing integrated online tools that make it easy to locate in-network doctors, manage plan specifics, quickly and conveniently from your phone or computer.
Makes sense. And finally, when you talk about network size and just sheer coverage, you have the behemoth United Healthcare, UHC. What's fascinating here, according to the source, is just the sheer scale of their operation.
Oh, yeah.
It says they boast a massive network of over 1.3 million physicians and healthcare professionals, and more than 6,500 hospitals and facilities nationwide. But I guess the question is, does sheer quantity ever mean sacrificing quality or maybe access to specialists? What did the source say about that?
That's the critical question, isn't it? Their size pretty much guarantees access, yes, but the benefit seems to go a bit deeper. Because their network is so expansive, they usually have, just statistically, the highest probability of covering those high-demand, highly specialized pediatric experts.
Okay.
Which is crucial if you're dealing with complex or rare conditions in a child. And they try to boost the healthcare experience by layering in valuable additional services. Things like 247 nurse hotlines, robust telehealth services, offering immediate advice and helping triage care when, your child gets sick unexpectedly at 2 a.m.
Yeah, that nurse hotline can be a lifesaver.
Definitely. That brings us to our final carrier, which really drives home the issue of system integration and cost, Kaiser Permanente. Their strong point is pretty unmistakable: affordability. They offer some of the most competitive, low-cost options out there with comprehensive plans available in the market.
Right. And their key differentiator, that integrated healthcare system, it's often misunderstood, I think. Can you maybe explain why that matters to someone listening?
Absolutely. So when we talk about an integrated system, what that means is the insurance company and the healthcare provider, the hospital, the clinic, the pharmacy, they're all basically the same entity.
Gotcha.
They own and operate everything. Now, why is this beneficial? Well, it removes a lot of administrative friction. There's generally no negotiation on costs between insurer and provider, fewer disputes over who covers what, and all your patient data is coordinated pretty seamlessly. This streamlined internal process often results in very high customer satisfaction and frequently significantly lower out-of-pocket costs because, well, they control the entire value chain.
It sounds like Kaiser really simplifies the user experience significantly then. But, even with the best plans, the sources we looked at point out that this world is, well, it's never perfect, right? What are the biggest recurring headaches consumers face that these documents highlight?
Yeah, that's the critical pivot, isn't it? The analysis definitely acknowledges that even with these top-tier carriers, people face real obstacles, like the sheer frustration of an unexpected denial of medical care, which is just a stressful nightmare for parents.
Oh, absolutely.
Or the shock of receiving higher-than-expected medical bills, often due to obscure pricing rules or out-of-network issues.
Oh, and that ties directly into the source's strong call for greater transparency across the board, doesn't it? The documents really stress that insurance companies must disclose information on their price negotiations with providers. Why is that specific disclosure so vital?
Because without it, you're essentially buying a product somewhat blindly. Transparency helps consumers, and employers too, compare packages point by point. It allows you to truly understand the underlying costs you are paying for. It kind of reveals the negotiation power of the insurance companies themselves.
You mean like, are they actually getting the steep discounts they advertise?
Exactly. Or are those savings not being fully passed on to you, the end user? Transparency is really the foundation of a truly competitive market.
All right, let's maybe stop talking theory for a second. For the parents listening right now, how does all this carrier strength stuff translate into actually getting, I don't know, a 2-year-old an emergency appointment? Or getting specific types of care? Let's talk specifics. What are the comprehensive pediatric services families actually need that the sources detail?
Okay, yeah. This is where we connect the dots to actual daily care your kids receive. The source material details a really comprehensive list of pediatric services available, showing the kind of depth of care that a strong network provides. This includes essential services like, of course, preventive pediatric care. That's crucial for things like complete immunizations. And making sure you receive the required vaccine information statements, or VIS, every time.
Right. And just to clarify for our listeners, VIS are those documents detailing the potential risks and benefits of a vaccine.
Mhm.
They're legally required to be provided every time a child is immunized, ensuring you have informed consent.
Exactly right. And beyond prevention, they also highlight necessary services like acute and essential after-hours pediatric care, which, again, is vital when your child wakes up with a high fever on a Saturday morning.
Yep, definitely.
But the specialized services listed are really what can separate the top providers. We're talking about things like lactation services, which are essential for many new mothers right after hospital discharge.
Okay.
Obesity medicine, which is unfortunately a vital specialty dealing with the growing childhood obesity crisis. Even things like medical ear piercings, which many parents prefer to have done by a pediatrician for safety and sterility reasons, sometimes even for kids who aren't regular patients there.
Interesting.
And of course, sports physicals for older kids getting into activities.
And there was one particularly interesting detail in there that kind of speaks to convenience and specialty management. The inclusion of newborn circumcision done by the pediatrician after hospital discharge. Why is having that done in the office post-discharge often preferred by families?
Well, it often comes down to minimizing hospital stays and maximizing convenience and expertise in that specific setting. Instead of managing a potentially complex procedure in a potentially more expensive hospital setting, it can sometimes be handled quickly and safely right in the pediatric office. This can reduce anxiety and often cost, too, provided, of course, you have a carrier that covers that specific out-of-hospital service, which usually requires a specific request form.
Got it. That whole robust list really underscores the absolute importance of choosing a carrier with that wide local network we talked about earlier. And the source material really drives home the local relevance for those of you listening in the Atlanta metropolitan area. It confirms that this depth of care is actually accessible right where you live.
Yeah, the documents explicitly outline that the service areas span a huge geographic reach, meaning accessibility for families across the entire Atlanta metro area. We're talking about key suburban cities like Alpharetta, Roswell, Milton, Johns Creek, also Marietta, Kennesaw.
Okay, pretty wide coverage.
Yeah, Dunwoody, Smyrna, Woodstock, too. And this access links directly and hopefully seamlessly to the major nearby hospital systems that families depend on, like Northside Hospital facilities, Wellstar facilities, Piedmont, and the various Emory hospitals as well.
Okay, so the conclusion here seems pretty clear, and it's definitely strategic. Selecting the right health insurance company significantly impacts your financial health, and, maybe more importantly, your immediate access to specialized, timely care for your kids.
Absolutely. Understanding the unique verifiable strengths of each carrier, whether it's United Healthcare's massive network ensuring that specialty access, or Cigna's specific pharmacy coverage helping with med costs, or maybe Kaiser Permanente's ability to minimize that administrative friction through integration. It allows you to make a truly informed and ultimately protective decision for your family's well-being.
That's the knowledge you need. So if you want to dive deeper into the specific plans accepted by practices offering these services, or get the comprehensive list of services we just detailed, or check the exact cities and hospitals mentioned to confirm your local coverage, well, the information is waiting for you. For more details related to the specific pediatric services, accepted insurance carriers, and geographic coverage areas we discussed today, please visit omegapediatrics.com.
That's OMEGA, pediatrics.com. Make sure you check it out.
And if you found this discussion helpful, and maybe feel a bit more prepared to navigate the world of health insurance for your family. Please remember to like the video, subscribe to the channel, and share this discussion with others who you think need this essential information.
Thank you so much for joining us for this really essential conversation today.
We'll see you next time.
Goodbye for